Peyote is the drug we will be talking about today. First, we will give a description of the drug, some background, components and brain structures, studies done on peyote, and withdrawal effects. Peyote comes from the peyote cactus, also called Lophophora williamsi. In a dried form, peyote contains 3 to 6% alkaloid mescaline, which is considered very high. Peyote is known to be a hallucinogenic drug and is found in southwest parts of Texas and Mexico. More recently, the drug's positive effects have contributed to a variety of mental illnesses, including depression, anxiety, PTSD, and substance abuse disorders. In relation to addiction, peyote is very low compared to other recreational drugs on the market. In the time of the Aztecs, peyote was used universally for ceremonies in the Aztec Empire during its Spanish rule, as well as in northern Mexico dating back to roughly 1520. It was mainly used for wounds, burns, rheumatism, snake bites, and scorpion stings. Peyote itself is more commonly used in rituals and ceremonies, while pure mescaline and its counterparts have major advantages such as temporal control and ability to adjust the dosage concentration. Since 1569, peyote has been a staple of indigenous cultures of North America and is stated as essential for rituals amongst the Native American Church. The recreational use of peyote has increased significantly since the 1970s. In the early 1970s, peyote was banned, but later approved through the amendments of the American Indian Religious Freedom Act, which permitted the Native American Church to use peyote for their bona fide religious ceremonies. Research in regards to peyote are seen through investigations into peyote's correlation for rehabilitating those struggling with alcoholism. This further sparked more studies into how mescaline can be used to counteract or help cure various mental disorders.
Brain structures. Peyote's main component is mescaline, and as with other psychedelic agents, the effect of mescaline is based on the binding and activation of the serotonin 5-HT2A receptor. These receptors are G-protein coupled receptors and can be found in the cerebral cortex, locus coeruleus, basal ganglia, hippocampus, pallets, and vascular smooth muscle. Mescaline has poor fat solubility, and this is why transport across the blood-brain barrier is rather poor. However, brain uptake appears to be relatively rapid according to some studies in cats. The accumulation in the hippocampus, amygdala, lateral geniculate, and anterior cingulate cortex could be still detected 18 hours after the administration, and the average hours of the trips when you give it in sporadic use, meaning that you don't use it usually, it's about 10 hours. Studies. In some studies, lower right hemisphere performance was observed after having ingested 500 milligrams of mescaline sulfate when the 12 healthy subjects solved a face-no-face decision task. In another study with rats, results indicate an association between mescaline-induced pathological aggression and abnormal electrical activity in the amygdala. Withdrawal effects. The physical responses to mescaline in 10 formerly morphine-dependent subjects were increased body temperature, higher systolic blood pressure and pupil diameter, and a lower knee pain threshold. Furthermore, some other described responses were altered visual, temporal, and sensory perception after the consumption of mescaline. Euphoria was another effect frequently described, but anxiety and panic, as well as depression, rarely occurred. In some cases, real visual hallucinations or pseudo-hallucinations occurred. The peak of the provoked effects was 2 to 2.5 hours after ingestion of the drug. At higher doses, over 400 milligrams, nausea and vomiting were reported as side effects.
In conclusion, peyote can be considered one of the safest drugs to take recreationally, although it is only legal within the act approved for the Native American Church. Making peyote more accessible within the medical community may help many people gain access to treatments otherwise unthought of.
And this would be the end of the presentation. Thanks for watching.